Amid an ongoing staffing crisis within adult social care, a high-tech new method of training healthcare students has been developed right here in the Midlands, which aims to reverse the trend.
Those studying at Telford College are now being taught using virtual reality headsets as a way of preparing them for difficult situations they might face later on. Amrit Birdie reports.
Qualifying for a job in healthcare requires years of training, and for good reason. These medical students at Birmingham City University will one day be responsible for the care of countless sick people. But how do they feel about technology such as virtual reality replacing some of the more traditional teaching methods they're used to?
They can actually simulate, painful reactions. They can actually simulate various kinds of diseases or conditions that we will meet in real life situation, and so it's really helpful.
What we're aiming for is for us to be trained safely. It's for the patient's safety, for ours, the trust, everybody's.
For health and social care students at Telford College, virtual reality is the reality of learning. The hope is that by virtually tackling challenging scenarios with digital patients, they'll be better prepared for the realities of working when they qualify.
When the students are in the headsets, it's not just about what they are seeing and what we can see them doing within this scenario. It's also their body language and the way that they react on the outside. VR creates a wonderful opportunity for the students. They're all internet savvy, they're all technologically savvy, and it just really creates a separate dimension, something that we can't create in the classroom.
Sorry, Amy, I really need another pair of hands.
Those behind the technology think that developing the students' emotional resilience is the key to not only creating better healthcare workers, but ones that will last.
Being able to kind of fully immerse the students provides us with kind of an opportunity for them to experience that in a way that they wouldn't be able to unless they were kind of on placement. And because placements are so difficult, giving an opportunity to virtually create emotionally difficult encounters that they are going to experience in the workplace before they even kind of get there is utterly invaluable.
But can virtual reality really compare to looking after patients in real life? Some of these students have already been putting that to the test.
Sort of gives you like an actual expectation of what to do there, so like you don't expect anything that's not actually going to be there, you know what would be in the setting.
I work in a care home as well, just like learning from here, and it's like so similar as well. So it was like I get in and I was like, oh, I think I know what I'm doing. I'm used to what's going to happen and stuff. So yeah, it gets me ready for the outside world.
As advancing technology helps these students in ways that never could have been predicted, those behind the VR project say they hope that every student training to work in healthcare will one day get to experience learning in a virtual world. Amrit Birdie, ITV News.
I mean, it's hard to get your head around, if someone as old as me, how you can learn like that. But then hearing that young woman there saying she actually works in a care home and using the virtual reality is just the same, it kind of proves, I guess, it does work.
I know, I was thinking the exact same thing. I was a bit dubious when I first heard about it, thinking, well, it's never going to be quite as realistic or as accurate as you would want it to be. But apparently so.
Yeah,
amazing.
Very impressive.